In this video, we'll talk about the internal medicine clerkship for medical students and go through what a typical day is like, the format of patient presentations, how to write notes, and how to maximize your learning and do well on the shelf exam. So starting off with a typical day, you'll usually get sign out around 6:30 to 7 a.m. depending on the institution you're working at. Sometimes the intern will get the sign out and you'll be able to come in a little bit later and get sign out from them. Once you kind of get what information and things happened overnight to your patients, you'll spend about 5 to 10 minutes, go through their chart, kind of look at what their vitals were overnight. You can also look at their labs, their imaging, if there's anything new, and you can move on and then look at any new notes, including consult notes or any overnight notes that were written. Once you're done kind of looking through all your patients, seeing if there was any important things overnight that you had to check up on, you can pre-round on your patients either with the intern or on your own. This depends kind of on your level of experience and how comfortable you are seeing the patients. Once you're more comfortable, you should definitely go and see the patients on your own so you can get practice kind of conversing with them and obtaining the necessary information. That usually takes 5 to 10 minutes per patient. Once you're done with that, you'll probably have a little bit of time before social work rounds start, as well as your rounds with your attending. And so during that time, kind of catch up on any information, put in any new consults that your team is thinking about, and you can start working on your note as well. Once social work rounds start, the key information you want to think about is really about the disposition of your patient. What that means is you want to think about how long is this patient going to be in the hospital for, what continued treatment will they need, and if they are going to go home once they're discharged, or are they going to end up at some sort of facility, either rehab, a nursing home, or whatnot. So it's important to kind of have a picture of in your mind of what the course of the patient's going to be, because that's important to consider when trying to set up things so that once the patient's ready to be discharged, everything runs smoothly. So then after that, rounds will start. They'll start around anywhere from 8:30 to 9 a.m., depending on your attending. And some attendings, they like to do what's called table rounds. You'll kind of just sit with all the residents and with the attending, and you'll go through patient after patient just on paper, and you'll kind of discuss the treatment plan and go through your patient presentations. Some attendings, especially at teaching institutions, likes to do kind of walking rounds where you'll go patient room, and you'll talk about each patient while you're outside their room, and then go see the patient all together. It kind of depends on whatever your attending's preference is, but I would get used to kind of doing both types of rounding. So rounds can take anywhere till 11 a.m. all the way to 1 p.m. It really depends on how many patients you have, how complicated the patients are, as well as how much teaching is being done on rounds. So once rounds are over, I definitely would call any consults that were discussed during rounds at that point, because you don't want to wait to call consults later, because then the service might not be able to see the patient the same day, and you want to definitely try and move things along in the hospital. So it's good to kind of call rounds before you, or call consults before you go out for lunch. After that, you can kind of finish your notes and sign them depending on any changes that happened during rounds in terms of any discussions you had. And finally, you always want to check up on your patients in the afternoon, evening to update them about the plan, talk to the family, give them any updates, answer any questions. So it's just important to check up on them and make sure things are going as planned. During the internal medicine clerkship, you'll give lots of presentations on rounds, and the two main formats for presentations depend on whether the patient is a new patient that's not known to the team, or whether the team is already aware of the patient and has seen them previously. So for new patients, you want to be pretty thorough in your presentation and include all the key details so that the patient is taken care of in the appropriate way. So starting off, you want to give the HPI. During that portion, right, you want to start out with your one-liner, really tell everyone why the patient is admitted to the hospital, kind of what is the story that's behind their symptoms. At the end of the HPI, you can include kind of a relevant review of systems where you discuss kind of the main symptoms that they either endorsed or they denied. So in this case, right, you could say, for example, the patient endorsed, let's say, chest pain and shortness of breath. whereas they denied abdominal pain, fevers, chills, nausea, and vomiting. So these are often some of the questions you should ask every patient. These are kind of symptoms that are either very common or things you want to rule out. So this I would almost always include in your relevant review of systems. And then depending on what the patient's complaints are, I would ask other relevant questions. Once you're kind of done with the HPI portion, you can move on to your past medical history portion, where you discuss any remaining past medical history that isn't discussed already in your one-liner. Once you're done with that, you can briefly mention any past surgical history that is relevant, and then move on to meds and allergies. In regards to meds, it's important to not go overboard with this, right? A lot of patients will be on like 10 plus medications. So you can kind of list off the medications. If important to the patient's condition, you can list dosages as well. But otherwise, just listing the medications is fine. And if somebody wants to know certain dosages, they'll just ask you. In regards to allergies, you want to mention what allergies the patient has in regards specifically to medications, and also describe what happens when they take those medications. You'll often see patients will have lots of listed allergies, but they won't really know what happened to them, or if they ever developed anaphylaxis or just were a little bit itchy after the medication. And it's important to just know that in case you want to use one of those medications to treat the patient. Once you're done with that portion, you can move on kind of to any relevant family history. There's no need to go overboard on this. If the patient has a family history that is related to the disease presentation they have, obviously mention that. If their family history is non-contributory, you can say that and kind of move on from that section. Finally, you can move on to the social history. And once you're on the social history, you obviously mention anything related to the patient's drinking habits, alcohol use, any other drug use, and you can mention kind of what they do for a living. But again, it's not if it's not as necessary for the patient's treatment, isn't as relevant to always mention it on rounds. Moving on, after you complete this history, you want to kind of give a brief summary of what you did for your physical exam. Again, be thorough, but try and be focused when you're giving presentations. You don't have to mention every little thing you did during your exam. You can obviously, if they came in with some cardiac complaint, obviously do a full cardiac exam and explain what your findings were. If everything is negative, then you kind of can just say the physical exam was unremarkable, or you can even be a little bit more specific and say you did an abdominal, cardiac, and pulmonary exam, and those were unremarkable. So it kind of depends on your attending, and you'll kind of learn what each attending prefers, and based on that, you can adjust your presentation. Then after your physical exam, you can mention your labs and imaging that were done, and really go through that in detail and discuss what labs are relevant, and move on to the imaging findings. Again, for this section, if there's something that's not as relevant, you don't need to include it, but for anything that's a pertinent, either positive, or if it's something that was normal that is pertinent, then I'll obviously mention that in your discussion. Finally, you'll go to the kind of the most important part of your presentation, where everybody will really be listening to your thoughts about the patient, and that's the assessment and plan section. So the assessment and plan section, you really want to keep that detailed and really discuss what you think about this patient and what you think are the next steps in terms of management. So your assessment is kind of a restatement of your one-liner, and then add a little bit more on top of that. You want to, in that assessment, really discuss what other pertinent physical exam findings there were, what other pertinent review of systems findings there were, and what other relevant labs and imaging were also seen. And based on that, you can really come up with a plan where you then discuss what your differentials are. You can discuss what your management plan is for each kind of condition the patient is dealing with. In terms of the plan, it can be quite complicated when you start out. So the best way to think about it is really start thinking about the conditions the patient is coming in with, the complaints they're having, and address each of them from most important to least important. So if someone came in with chest pain and we don't really know why they're having chest pain, right, you can kind of start out with your discussion of chest pain and then list kind of what your management plans are in regards to that chest pain. Then, for perhaps, right, they have a past medical history of, let's say, diabetes or hypertension or so on. And those, right, if their chronic issues are less important as long as they're being managed okay. And I would include those after that in your presentation. Similarly, in your note, that structure would be pretty similar. So for patients already known to the team, the presentation format is slightly different. It'll be more condensed and focused. You don't have to go through and give all the information you did previously. You kind of only give newer information. The best format that I find is called the SOAP format, where you first start out with subjective information. And in this information, you really give about information about any overnight events, including any changes in their vitals, any new intervention that had to be done overnight. It's really there to make sure that there was nothing missed overnight that happened to the patient. So it's just important to also clarify with the patient how did they feel overnight, ask them kind of the relevant review of systems. Do they have chest pain, shortness of breath, fevers, chills, so on and so forth. So it's just really to make sure that the patient is doing okay and there were no major changes. The objective portion is the second part of this mnemonic here. And in this portion, you'll discuss the vitals, you'll discuss the physical exam again, you'll discuss any new labs, new imaging. And so it's really about the objective portions of the exam that you've done. In terms of the assessment and plan, again, right, you're going to do similar to kind of a full patient presentation. You'll give a one-liner again where you kind of summarize the patient as well as their general condition. And then you'll go to the plan where you'll go from kind of the most important diagnosis or most important problem they're having right now to the least important, and discuss kind of what interventions are being done and what changes should or should not be made. So in this portion, right, let's say the patient came in with chest pain. So that's kind of their most important complaint. If we have a diagnosis for that, right, let's say they had like an NSTEMI, right, so that you would also list as well in your kind of diagnosis portion. Below that, right, you can kind of discuss all your other kind of management plans, any imaging you've done, other things that are important to that specific diagnosis. After that, right, you can kind of go on to the chronic issues, right? If your patient has diabetes, if they have hypertension, you can kind of bring those up after and just say, you can, if there was no changes in those conditions, if you're not changing management, right, you can just kind of say continue the same management or continue whatever medications they're on specifically. So that's kind of the general format of how to give presentations for people who are already known to the team. These, right, are a lot briefer. The new patients, often the presentations can be anywhere from 3 to 5 minutes. These kind of shorter presentations are often only like a minute or two, depending on the complexity of a patient and depending on if there were changes overnight. If lots of things happened to the patient overnight, then obviously this would require further discussion and changes in management. So it's important to consider those as well. Finally, writing notes is also one important task that you'll have to do. And in this case, right, the most important section you'll write is the assessment and plan portion. And there's kind of a certain format that people tend to follow, right? They'll kind of first write out their assessment, where it's mainly their one-liner, along with a little bit more information in regards to pertinent positives, pertinent negatives, or kind of what they think is going on and how the patient is doing. Below that, your plan should be usually problem-based if you're working on the floors. Sometimes in the ICU, you'll, because of how many problems are going on, it'll be system-based. But for the most part, as a third-year medical student, you'll definitely be more expected to work with a problem-based plan. So for problem-based plans, you usually start with the problem that's most severe, that's currently requiring the most management. And that, right, is kind of will be your number one problem. And usually I'll put it at the top and list it as such. And so in this case, let's say the biggest problem is chest pain. Below that, I'll kind of indicate what labs that we did that were relevant to the chest pain. Were they positive, negative, and in that regard? And I'll also list any imaging that is also relevant to the patient's chest pain. Below that, right, I'll list more chronic issues. So for example, again, if the patient has diabetes, Then I'll list their diabetes. I'll list kind of the medications they're on and what we're doing to manage their diabetes. And then I'll list their other also chronic conditions. Let's say they have hypertension. Again, below that, I'll list what things are being done for their hypertension. So this problem-based kind of plan, you'll start from most important, go to least important, or kind of the least severe, and you'll list kind of what you are doing for the patient, as well as if something is unclear of why the patient is experiencing some symptom, you want to kind of indicate some differentials, what you're thinking about, what you're doing about it. The notes are really important for making sure that other services that are helping you treat this patient understand what is going on. So, this is commonly the part of the note that people will look at. And so, it's important to be very clear and concise in this portion so that everybody knows what's going on with the patient. Similarly, right, other parts of the note that you want to make sure you remember to do, you want to include any overnight events in the subjective portion of the note and specifically mention any changes or new information that you gathered or saw in the chart. You also, right, want to really keep the hospital course up to date. This is often a section that you'll see is not really kept up to date by interns, residents, attendings, right? It's important to keep it up to date because when you're discharging the patient, you have to write a hospital discharge summary. And in order to write the summary, you really need to understand kind of how the patient's care took place over sometimes the weeks that they're there. And so if there's a hospital course that's kept up to date, it's a lot easier to write that summary than when you have to now scavenge through like 20 notes to try to figure out what was the progression of this patient's disease while they were in the hospital. Also, right, obviously you want to include your review of systems, your physical exam. Again, only document what you do. In terms of labs and new imaging, you can usually bring that in directly into your note so that that is also seen by anybody kind of looking through your note. And it's just a way that when a consult service can look at what's happening to a patient, they can kind of see everything in one place as well. To maximize your learning during the rotation, there's a couple different ways that I found that were helpful, right? The first thing is you're going to be seeing 1 to 3 patients per day that you kind of follow. And so it's important to really learn about their conditions, understand kind of the pathophysiology behind their conditions, as well as obviously the management of their conditions, because that will help you then learn not only for the exam, but in the future when you have to take care of patients. Also, commonly, right, the patients will be on a lot of different medications. So it's important to learn kind of the brand as well as the generic names and really understand kind of why the patient's on a certain medication. And this is commonly a question you'll be asked on rounds. If a patient is on some unusual medication, you'll be asked, why is the patient on that medication? So it's good to know kind of all the indications of the medications they're on. Finally, right, you really want to know how to use UpToDate. You can have the app on your phone. It's very effective at quickly looking up information regarding management as well as even diagnosis and other things regarding your patient's conditions. So it's important to learn how to use it and kind of read it in order to learn as well. Also, there'll be plenty of downtime during your day, especially in the afternoon. And so if there's not anything you can help the team with, I would kind of sit down, do a couple UWorld questions, and start reviewing a little bit of the higher yield content that you'll see on the exam, and also just you'll see day to day on the patient floors. To prepare for the shelf exams, UWorld is your best friend. There's a lot of questions, around 2,000. And so you do have to end up kind of doing a lot of questions per day, but it's important to remember that quality is better than quantity. So really focus on the questions you're doing, learn from them. And what I found the best way is to first start out by the system base. So first do like cardiac questions, do like a couple sections of that, do some GI, do some renal, do some pulmonary. And then after you're comfortable with each section, you can then kind of change UWorld to have more random questions. So then you're able to practice how the exam will actually present. But initially, when you don't know a lot of the different topics, it's kind of difficult to do random questions. And I found that doing by system is a lot better for learning, as well as then prepares you better when you're finally going to take the exam. There's a lot of video sources for internal medicine rotation, including online MedEd, boards, and beyond. And I found that those have pretty good review videos for certain topics. And you can always supplement your knowledge using them, and even start watching them at the beginning of your rotation just to kind of get a good framework where you can learn the rest on the floors. The last thing is the NBME exams. There's practice exams available that are helpful for the IM shelf exam. So those can be done in the last 2 to 3 weeks when you're just really reviewing the information and just seeing where you're at in regards to the exam. But again, a lot of your learning can be done from UWorld. If you're able to go through most of the questions, you should be good for the exam.